Good morning. My name is Marita Titler, and I am a professor and associate dean for practice at the University of Michigan School of Nursing. I also have the great honor to head up or provide direction and leadership for the Community Engagement and Research Core, which is the core that is sponsoring this program in MICHR. And this is our first annual Implementation Science Conference. This is a conference that has been talked about, I would say, for several years. And those of you who know me, I'm kind of a, well, why aren't we doing it person? So I said, we have to do this. So this is our first conference. We look forward to your comments on what you might like to see in subsequent years. We have some great venues, I think, in store for you today. So I just want to remind us that implementation science, that is investigating knowledge uptake and use at the point of delivery in healthcare, is a goal of the all national CTSAS and is central to the Outreach Partnership and Implementation Science Core of MICHR, that is the Community Engagement and Research Core. Some implementation science initiatives that we are embarking on in the next upcoming years include this annual symposium. We have had and will continue to have pilot grant funds in this area and facilitating interdisciplinary investigative teams and collaborating with practice networks and community-based organizations. We also will be working on and moving forward in collaboration with the Education Core. What kinds of workshops and seminars can we host in this particular area? So that's very exciting, I think, for us here at the University of Michigan and in the Midwest. But more importantly, this conference today was really structured to give you some time to network with people. So having heard all the buzzing at the beginning, I think is great. We would continue to ask you to do that. It's also designed to learn about initiatives to advance the science in this area of implementation, to provide other opportunities for you to ask our speakers questions and have some discussions in this area, and to set forth a call to action. At the end of the day, we will have Dr. Carolyn Clancy with us. We've asked her to join us so that we could talk about training programs in this area. So on behalf of MICHR and the University of Michigan, I welcome you to the conference. We do encourage you to network, to ask lots of questions. We welcome your thoughts, your insights, your learning in this area, and we particularly ask you to give us that information on the evaluation form as well as discussion from the audience. So without further ado, first of all, I would like to acknowledge Dr. Tom Shanley, who is with us today. He's the PI, or Director of the Michigan CTSA, or MICHR. He is the person who keeps all the component parts running, and so we're glad to have you with us today. Do you want to stand up? I would also invite those of you who are faculty in our, and participants in our Community Engagement and Research Core, or otherwise known as OPUS, to also stand up, because I would like you to interact with these people during our conference today. So Scott's here, Lee's here, other people, yes, great. Dean Smith, Carolyn. So thank you very much. And so I'm going to introduce Dr. Jeremy Grimshaw. I think we are extremely fortunate to have him spending the morning with us today. He, in my mind, is the international scientific expert in this field. He has many credentials. I told him if I introduced him with all of his successes, I would be taking up the full 50 minutes that he has. But just some highlights is he's a senior scientist in the clinical epidemiology program of the Ottawa Health Research Institute and director of the Best Practice Institute of Population Health at the University of Ottawa. He holds a Tier 1 Canadian Research Chair in Health Knowledge Transfer and Uptake, and is a professor in the Department of Medicine at the University of Ottawa. Prior to this, he held a personal chair in health services research at the University of Aberdeen in the UK, and was the program director of the Effective Personal Program, Effective Professional Program within the Health Services Research, which is probably the largest implementation research program within the UK. Among other leadership positions, he is currently the coordinating editor of the Cochrane Effective Practice and Organization of Care Group. He has done huge numbers, large numbers of studies in this field. So please join me in welcoming Dr. Grimshaw.
Good morning. It's a real pleasure to be here. It's actually this. I hadn't come to Michigan until I think the fall last year, and this is the second time in 12 months. So I clearly like it. I actually like it even better when it's moving into summer and the weather is warm and the trees are green and you can wander around in your shorts. So hopefully I'll get more opportunities to come back as well. So what I want to do today is try and provide an overview of where I see the field is. To give you some of my background, I trained as a family doctor in the UK. I did a PhD which was looking at interventions to improve referrals from family doctors to specialists, and that led me to this area of implementation science, and I've been working in the field now for over 20 years, which I think it probably means I was kind of one of the first people in some of this space, which is why I probably have an august record, because I wasn't competing against a lot of people. So what I'd like to do is just tell you a bit about how I perceive implementation science, what progress we've made to date in the field over the last sort of 20 to 30 years, and I'll use a number of examples that are predominantly my own examples, and that's largely just an availability heuristic, but also because I can talk to them in some more detail if people have questions. I then want to sort of pose 5 challenges for the field. I think there's a substantial increase in interest in this area, but it really then poses challenges for how we organize the field and really make sure that the field advances in a way that provides value to healthcare systems and to funders, so that in the future there's going to be sustained funding and efforts in this area. And then finally, a few comments about developing the field. So that's what I hope to do in the next 50 minutes. And the background to this is we have, from studies around the world, consistent evidence that healthcare systems and healthcare professionals do not provide the level of care, the quality of care that they aspire to. Repeated studies have shown that between 30 to 40% of patients do not get treatments of proven effectiveness, and around 20 to 25% of patients may get care that's not needed or is potentially harmful. And these studies have been done in the US, in the UK, in Australia, Canada, China, South Africa, Thailand. It's a common theme across all healthcare systems in the world. I don't think any healthcare system has got it right. And I think this suggests that implementation of research findings is a fundamental challenge for healthcare systems if they want to optimize their care, outcomes, and costs. And I'd also argue that if we could actually implement what we know at this point in time, there would be significant population benefits as well as sort of economic benefits in terms of the payback from being able to do that. The fact that we've got great discoveries about how to actually improve quality of life, improve survival, and we're not using them is, I think, a real challenge for society. So I think a key challenge is implementation, but implementation is a human enterprise that we can study to understand and improve knowledge translation and implementation approaches. And I would argue that implementation science is a scientific study of the determinants, processes, and outcomes of knowledge translation and implementation. And the goal is to develop a generalizable empirical and theoretical basis to help optimize implementation activities. I think in a service setting, there's a great pressure to do something. Because we see these failures of the system, and we really feel that there's an urgency to address those. But I think alongside those sort of those attempts, we also have to try and develop a much more stronger scientific base that actually allows people to choose interventions or programs or strategies that they can have more confidence will likely lead to the improvements in quality that they are actually looking for. One of the challenges in the field that I'll come back to at the end is just the profusion of terms that are used, sometimes synonymously, sometimes differently. We did a study where we interviewed 30 funders from 8 countries around the world. All of them said this was part of their mandate, but they had 31 different terms that were being used to describe this field. And one of the challenges with this is you get into sort of rather semantic debates about, do you need to have knowledge transfer before you can have knowledge translation? What's the really, how does knowledge translation and quality improvement relate? And I think these are rather sterile discussions. What we need to do is recognize that what we're trying to do is promote better use of research evidence to improve the quality of care and outcomes of patients and citizens engaging with healthcare systems. And so I'm going to use implementation science, but I have another set of slides where I'd probably use one of these other terms depending on the audience I'm talking to. And I don't think we should get too hung up about these high-level things. We should be focusing on what we want, which is to improve the quality of care, improve the use of evidence in practice and policy, and not what we call it.